Hello, guys. You're welcome to another section again with your regular host. Welcome to PCE Studios, and we have a very great personality in the house tonight. I know it's going to be fun. You're going to learn something new that you haven't heard before, that you've not learned before. I'm telling you, I'm very sure of this. And whatever we're going to be discussing today is something that relates to your health, something that you're going to learn from. Okay, so I have a medical personnel in the house. Hey, guys, you want to see her, right? I have my beautiful sister in the house. It's going to be a discussion. This is not like, we are not going to be too serious about it. So we are relaxed. We're going to be having fun together because it's just a sisterhood thing, and we're going to be doing this beautifully. So I want to introduce to you my beautiful sister, Oge. Sister Oge, you're welcome.
Thank you, ma.
Welcome to this beautiful studio of ours, PCE Studios, and we have the honor and privilege to host you tonight.
I'm honored
Wow,
to
welcome, ma. Sister Oge, can you just introduce yourself a little bit? Let's know who we are talking to.
My names are Honorable Oge Ojeri, and that's it.
Oh, wow. Guys, you see how she just said it? I forgot. She's an honorable. So, honorable, you're welcome. I'm moving forward. I'll address you as honorable.
Yes, please.
Oh my God. So, guys, like I said, we're going to be having fun, okay? So, if you're just joining us, you can share this broadcast to reach out to more people, invite people to join us. All right, thank you guys for all your support. We see all the love that you show to us, and we are so, so grateful. Okay, Sister Oge, my honorable sister. You've been a medical personnel for how long?
Well, for over 10 years now,
Wow, that's over a decade.
yes,
That's a long
I
time.
graduated from School of Nursing in 2012,
Wow.
and I went further to become a midwife,
Hmm.
yes, in 2015.
Wow.
Yes, and we're
Wow.
here today.
So, which means that you've had so many experiences, you've attended to so many cases. And in all of this, what has the experience been like? Before we go into our topic.
Well, I'll say back home, not here.
Okay.
Back home, I had a lot of it,
Mm.
especially with our people, the struggles
Mm.
of forcing down things to them,
Mm.
like explaining to them this is what should be done and
Mm.
this is what should not be done.
Mm.
You know how stubborn our people can be.
I know, right?
Before you say one thing, you hear someone else saying, this is not so. My grandmother taught me this,
Hallelujah.
and my grandfather told me this.
Mm.
In my family, we've been doing it this
Ayama.
way, so you cannot start telling me now that this is the way it is. So that is a bit of a struggle, especially back home.
Back home in Africa.
But down here, people are well informed.
Mm.
Yes.
Mm.
Once you tell someone that they have malaria,
Mm.
believe me, right in your presence, they go to Google, they search,
Mm. Mm.
they read about it, and they ask you so many questions,
Wow.
and they will be informed.
Mm.
So it's very easy for you to speak to someone who is informed.
Absolutely.
If you're saying this is what it is, yes, I know, or I agree with you.
Absolutely.
But with our people back home,
It's more
it's a
difficult.
struggle. Yes.
Guys, it's just started and I'm already being blown away. I'm telling you guys. If you're just joining us, just get a seatbelt right now and don't move away because you're going to be blown tonight. So you just heard what she said. As a medical personnel for over 10 years, her experience has been beautiful, but the people she has met in the process, which is, she coming from Africa and working here in Dubai, because of the nature of our people, it's been easier for her to do things here because of the information. So guys, I believe that we're passing out information right now is for people to get better and know that everything you get from a medical personnel, there's a way you can relate to it. Learn from it. Don't just argue with everything they tell you. Everything must not be done the way you know it. Things are, life is progressing. Medicine is progressing. Things are coming up on a daily. We have technology working out a lot of things. So what you knew 10 years ago, what your grandmother knew 20 years ago, may not be applicable now.
Yes, especially, maybe most of our grandmothers, grandfathers, they did those things and there was no effect on them. You could try it in this day, like this generation,
This era,
and
yeah.
then it's become something else.
Hmm.
But people don't want to listen to that.
Wow.
Yeah.
Wow.
So
And it has been tough with that because
Of course, very, very tough. When you're telling someone like, let's just say, for example, blood pressure, you have blood pressure, and this is the way it should be treated, and all that, they'll be like, first of all, I've had a case, I'll tell you about this, sorry, I'll just digress. I had a case of a lady who was pregnant and was in labor. Everything was done, and it was found out that she could not push the baby out. So she was told, Madam, I think we think you might need a cesarean
yes.
section. Casting and binding, just that. I am a choosing. Sorry about that if you're choosing, but I'm just trying to, like,
I know,
yeah.
I know. These things happen.
This is not in our family. I forgot the exact words
Where
she
she
used.
is.
She was just trying to say, in my family line, the CS is not there. No one has ever done it in my
Are you
family.
serious?
For God's sake, everyone in your family cannot be the same. Yes, cannot be the same. So it's usually
I have sister. Something that
definitely.
I was having Michael. So had so much, but I told my I made sure sometimes so many excuses like my husband doesn't have money. I want to give birth in a prayer house. A lot of things.
Yeah.
Yeah.
And you
So
also see women that, okay, they come to the hospital and they are fully aware that
their baby
they,
is
they are
rich
going
or
to be
something.
having a cesarean section. So you ask them, they've gone home, they told their husband. Most of our husbands too are not healthy.
Okay, now.
And the man says no. The same issue of my family has never, they deliver like the Hebrew
Women in
quotes. Yeah. They deliver like the Hebrew women. Why is your own different? And the husband somewhat not supporting her. When she comes to the hospital, for God's sake, you are the patient.
Absolutely.
You are the one
Whose life is on the line.
You should sign for yourself. Yes.
Oh, it's possible to do
yes,
that.
you can sign for yourself.
Wow.
Of course, even if the doctor or whoever says you can't sign, please bring your family members to sign for you. Don't wait for any man. Don't play with your life. So because the husband is not coming, the lady will be pleading. A lady in labor, I'm talking about a lady in labor, maybe along the line she was pleading with the husband, please now, they said this is the only thing, please come and sign for me. No, it shouldn't be that way.
Okay, so guys, you know what's gonna happen? We definitely have to bring back Sister Oge for this section because as she's talking, I'm just remembering a lot of things on this line. So, but today we're going to be talking about something very, very crucial, something that so many of you know, and I'm sure a lot of you don't even know that because most times what happens to a lot of people is when they want to get married, that's when they go for these things. Hallelujah.
Amen.
That's when they go for these things. And because so many churches are aware because of the crisis we've been having and all that. So a lot of churches, what they do these days, they tell you what's your genotype, what's your blood group, have you checked this, have you checked that. So churches are helping on that area because they did that to me. So and that's the time when so many people start running to check. And they want to get married though. You see what's happening. Probably they've been dating for like 6 years.
Of course.
So these are the things that we want to talk about tonight. There is something they call genotype, there is something they call blood group, and people don't know. Please, ma, can we just have a little light about what these things are? Because these things are wrecking homes. Children are.
Yes. Thank you very much for that question.
Yes, ma.
So everybody has a blood group and as well as a genotype, right?
Every human being.
Every human being, yes. Every human being has that.
And we all have different. Sorry for interrupting.
Of course, we all have different. I can be sharing the same with you or you with your husband, but everyone has theirs.
Okay.
So let's start with the blood group first. We have different types. We have the A, we have the AB, we have the O. All right? So in this blood group, there is usually one, let me say for example, if you are O, there is usually another sign,
Okay.
plus or minus that is written beside it. So that's on the blood group.
Yes.
Then the genotype, we have different also. We have the AA, the AS, the SC, the CC.
Oh, there's SC.
Yes. There are so many of them.
Am I the only one who just said that? Okay.
So,
really?
For the blood group, let's start properly with the blood group. Usually, the blood group, I will say, does not affect your health or your marriage.
Okay.
Yes. You can share the same or different with your husband.
Yeah.
That's not an issue.
Okay.
But where the issue comes is the sign on it.
Of the blood group?
Yes. If you're positive or negative. Let me say your blood group O. Are you O negative or are you O positive? The sign is very, especially if the couple plan to have children.
Are you sure I'm aware of what you're saying too? Because I'm shocked because okay.
If the couple plan to have children together, then that should be put into consideration.
Okay.
Let me give an example.
Please.
That's called plus or minus sign is called a rhesus factor.
Okay.
Actually.
Okay.
You are aware of it, but maybe
you've thought about it and I read about it, but
so the rhesus factor is what we are going to be concentrating on today, because that's the part which affects the marriage if you're planning to have a child. Okay,
guys.
So for example, if you are a rhesus negative mother and then you're married to someone who is positive and you're carrying a baby, most likely the baby will be positive.
Which is good.
Yes, which is okay, which is good.
Okay.
Most people are actually positive. The negative ones are just...
It's rare.
Yeah, few.
Very
they are there, but few. The positive are more.
Okay.
So if you are a rhesus a negative mother and you're carrying a baby who is positive, at first, that first pregnancy, fetal blood doesn't mix in pregnancy, except there is, you share things with the child, but not direct contact of blood.
Okay, that's why we have people who have HIV, they can have a child and the baby doesn't have it directly if caution is taken.
Yes, if medication is being given. Because there is the placenta, right?
Yes.
So this placenta is the barrier between the mother and the child.
Okay.
Whatever you're giving to the child will first of all get there and then transfer to the child, but not by direct blood contact.
Okay.
Okay. So usually when you're pregnant, you don't get to mix your blood with that of your child. All right. But in some cases where there is maybe bleeding, all right, or what we call placenta abruption, like the placenta tries to pull from your own body. The placenta is
it's inside.
Stick to your uterus, like your womb. So if there is anything, maybe because of some trauma or anything, the placenta tries to pull, or you're having a miscarriage or even an abortion.
Wow.
Right? So there is an exchange of blood. There might be an exchange of blood between the baby and the mother. So you being negative and your baby being positive, that's where the issue lies. Okay? The baby's blood gets into your own blood, mixes with your blood. Because the baby is positive, this is what we call incompatibility, rhesus incompatibility. Okay? Because the baby's blood mixes with yours, our bodies are built in a way that once something happens or there is a foreign body, the body activates, like brings out its soldiers and say, look, this is a foreign thing, this is a new thing. The body antibodies, we call it antibodies. Okay. They say this is something foreign to us, this is not part of us, we must push it out. This happens whenever anything that is not part of you enters your body. Okay? So in this case, when it happens this way, when the baby's blood mixes with yours, this is called sensitization. Sensitization occurs. In that, what I just explained, your body knows that this positive is foreign. This is new to us. This is a threat. So we must come together to kick against this threat. Yes. Now what happens is the baby is already born, right? The body only gets sensitized. Like they become aware that something like this exists for future purpose. Wow. I don't know if you're getting what I'm trying to explain. So when your body gets sensitized, antibodies are formed. You might be wondering, okay, maybe a lady is pregnant and then something happens, she had bleeding and the pregnancy continues, something like that. It will be there, but these antibodies do not form overnight. It will be before the baby is born, the antibodies must have not been formed. They will take a very long time to form. So that first baby for this woman is safe. Okay? When the baby is born, the baby is already safe, but the mother's body is already sensitized. The mother's body is already aware that once I see this in the future, I'm going to fight against this because this is not part of me.
Wow.
Okay, so how this affects the child or the children is the subsequent pregnancies. The first one is already saved. The subsequent pregnancies, once the woman gets pregnant and it's another positive baby, because the body already kept a record that this is not part of me, I have to fight this, they begin to attack the child. Yes, while the child is still in the womb.
Wow.
Okay, so
wow,
that's about it.
Yeah. So are you trying to say that you're going to answer the other part of the AS, as pertaining to who you can marry,
yeah, let's deal with blood group first.
But this one that you're talking about, so what you're opening my eyes to the fact that so many people, because we've had cases where you see somebody have one child and then the person is unable to have another child, and then you start wondering, is it witchcraft?
Yeah, of course. Everything for us is witchcraft, I know.
Then you start wondering, is it that something has happened? Sometimes you even blame the doctors or nurses to say maybe they tampered with something in the womb, because how is it possible that a woman that had a child the first time without any help, naturally, and then she's unable to conceive again? And at this point, so you're opening my eyes to know that there is something that can actually happen, and that will make most women not be able to conceive again, or probably have a child.
The woman might conceive again.
Yes.
But the baby is already in danger. Because the antibodies will attack the baby while in the womb.
And if it's positive, it's still going to be a problem.
Yes.
Wow.
If the baby is positive. See, if the second pregnancy comes, like she's pregnant for the second time and it's a negative baby, that's fine. Because the mother is
positive.
Negative. Okay. The mother is negative. It only happens if the mother is negative and the child is positive for the first pregnancy. And the subsequent one also, the baby is positive again. You understand?
Yes,
the mother's body is already sensitized. It's already aware that this positive, I encountered it before and it's not part of me. Now it's coming back again. This is the time to fight it. So she might get pregnant actually, but
being able to
miscarriage,
have the child.
yes, she might not be able to have the child. With close monitoring, she will be able to have this child. But the frequency of the hospital visits and so many things.
And somehow it can be expensive too.
Of course. So many visits and so many tests would be carried out. But that's not to say there is no solution for this, right? You can marry anyone you want. These factors decide somehow, but not entirely.
Okay.
Right?
Okay.
So what happens in these cases? There is an injection that is usually given to the mother. We call it rhesus immunoglobulin.
While she's pregnant?
Yes.
Okay.
While she's pregnant, around 27 to 28 weeks, she'll be given this injection. Then once the baby is born, the baby will be tested. And if the baby is actually positive, within 72 hours of delivery, she will be given another injection.
In case of future pregnancy?
Yes. What this injection does, we also call it Rogam. Some people might know it by that name. So what this injection does is, it prevents the body from, the mother's body now, from developing these antibodies that are ready and waiting for the next pregnancy. Wow. So if the woman gets pregnant again and is another positive one, same thing would be repeated.
Oh, at least that's not to say we are encouraging it. It's good for people to know where they stand, because that process of getting pregnant, having a miscarriage is tough. People need to go through evacuation and all that, which is really tough. So it's better you are aware of what you're going into. All right. So please, why we do all of this is to sensitize and make people know that there are things that can actually risk their life. All right. So please be aware. In as much as we have solution, please be aware. But I want to know also, how can people actually know this? Like, because I think it's from you that actually learned this for the first time when you taught in church during our women's program. I've never heard about it. The resource factor, I've never heard about it, because these things you don't get. The only thing you know is are you AS? Are you AA?
Yeah.
And you see people bragging, oh, I'm AA, I'm super this. So people don't get to even know this part of the resource factor, to know that somebody can get pregnant and get a miscarriage. It's not something we are taught. Most times we just feel that, oh, it's spiritual and all that. So how can people be sensitized about this? Like, how do they get, is it that they need to be pushed? Or I don't know if you understand the question that I'm trying to ask.
You're asking how can people know?
Yes.
If maybe their body is sensitized.
So the person they want to marry, they must have a test or something.
Yes.
Okay.
Just going to the hospital to get your blood group done.
Just like you have your AS test.
Same. Also. If you know your blood group, if you're listening to me and you know your blood group, you already know what I'm talking about. Maybe your blood group is O positive, O negative. It's not more than that. Just the positive or negative part that comes after mentioning your blood group is what we are talking about.
So what this means is that we actually escaped, because I didn't know about this. I only know that I am.
But the good thing is when you go to the hospital, though I've seen cases whereby someone goes to the hospital and they check their genotype and blood group, and then in between, like while in the marriage, something happens and you go back and check again. It's very different from the first one,
Yeah.
So issues like this do come up. But irrespective of that, go get checked. Know your blood group. Know your genotype and all that. Know
where you stand.
Do it more than once. Don't do it just in a place. You do here and then you go somewhere else and check again.
Guys, did you just hear that? I know this one you just said is difficult for a lot of us, I'm included. Because sometimes you look at the money and then you be like, this money now I want to go and give it to the hospital. Is anything even wrong with me?
See, the problem is this. We tend to look at money too much.
It's all of us.
Especially back home. We tend to look at money. Okay, let me say, if this woman, this negative mother, is not aware of all of these things,
yes,
and then her body is already sensitized, she gets pregnant again, and maybe goes to the hospital and they find out that this is the case. I already told you she will have to take frequent visits to the hospital,
which is consultation and payment of
the money you're running away from, you're going to spend it. And I'll tell you, the baby is not safe. This woman can have a stillbirth, a miscarriage along the line. So many things can happen to that child.
Our own life also.
Because what happens is once the antibodies from the mother attack that of the baby, the red blood cells of the baby, it causes destruction to the red blood cells of the baby. Now the baby starts getting anemia while in the womb. Yes, the baby starts getting anemia while in the womb because of this reaction. You know what that means? Sometimes in the hospital they will tell you that the baby will be transfused. Like the baby will be given blood.
No, they remove all the baby's blood
in the womb. I'm talking about
serious?
Before the baby is born. In severe cases, yes. So just think about it, like how much you're going to spend. The baby is already anemic, and then the liver, the heart.
They're already giving someone's blood to a baby inside the womb. That's serious.
Because once that destruction starts happening, anemia sets in. The baby's heart is already very small, and once the red blood cells are being broken very fast, anemia sets in, and then the heart will try to compensate. The other day in church while we were discussing, I made mention of the fact that once something happens with your blood pressure or with your blood volume, the heart tries to compensate by pumping more. You can imagine that fragile heart trying to say, okay, I am pumping blood because there is something we call the hemoglobin. It is part of the red blood cells, and it is the one that carries oxygen around the child's body. Okay? Once these red blood cells are being destroyed, these hemoglobins are being destroyed, that means less oxygen for that child inside. Okay, the heart will try to say, okay, something is happening somewhere. I don't know what, but let me try to pump more blood in order to overcome whatever it is that is happening. That tiny heart will beat and beat and beat, and then there is an organ called the spleen. That is where this blood is formed, the red blood cells. That organ will also be there and saying, okay, I am making this blood, but they are getting destroyed, right? Let me make more. The spleen is also overworking themselves.
The baby in the womb.
Yes. And the liver takes care. Once red blood cells are broken, the hemoglobins are broken, the liver takes care of it. Put some in the poop and all that, takes care of the excretion, removing it from the body. The tiny liver is also saying, okay, what's happening? I have a lot of work to do, so many things, you know.
So it's serious division of labor inside.
Yes, serious division of labor inside. And this division of labor, the medical practitioners and everybody will be running around to take care of these things. That means more money. So what have you gained?
Don't even go there. I know when these things happen like this, because only going to the hospital for consultation, you know how much you pay, especially when you don't have insurance. How much more when things of this magnitude happen to somebody? So the same money you're running from, you're going to spend more.
Yeah.
And then you have your life on the line, you have the child on the line, and I know how painful it can be to be pregnant and have a miscarriage.
That's it.
With all the expectations and hope. Then it's even worse when you have a stillbirth. So it's something that we really need to be careful about. Anything that pertains to our health, we need to be careful and make serious decisions about them. You know, let's try to look beyond the money and do what is necessary. In as much as we believe that God is the one who is going to keep us and all that, but we have our part to play. So guys, I hope you're learning something. Share this broadcast. Thank you so much for your support. So the AS part, we've had issues where I'm not going to forget, never, because I know somebody who lost about 6 children. Yeah. And one of my stepmother, there's what they call Abiku, those who are from Nigeria. One of my aunts, they call her Abiku. So when I asked, they said the mom used to have children that were dying. It is when I started knowing, I told myself, no.
Something must be wrong.
It means that probably my grandfather was AS. Maybe that woman was AS. Because I looked at it, all other women, my grandmother and the other, because my grandfather had 3 wives. They all had children, nobody died. But she was the only one who was losing children. They said she had so many, you know. If not that many of them, they were having so many children in the olden days, they won't even have children now.
Yes.
And so you see one woman losing like 6 children. That's a lot.
Yeah.
How many? So you see, these are the factors. But because they were not aware, and as I speak to you now, so many people are still very ignorant of it. They don't care. They are just in love. Please, ma, now that we have the opportunity to sensitize people, because that's what we are doing. We are just sharing this to bless people and to make them aware of what, you know, the future lies for them, of what difficulty and problems they can enter. You know, so many people are always in love. They say, oh, I'm in love, I'm in love. And then you see this cute guy, you see this beautiful lady. You don't look beyond that. Unknown to you that you are going to raise a family. So it's beyond you. So at this point, how can we sensitize people on, you know, what the what do you call genotype, how it represents, how it works, and, you know, the measures to be put in place, ma'am?
Okay. So coming to the genotype, as I mentioned earlier,
yes, ma'am,
we have the AA, which everybody, I think this
we are very proud of.
Lately, people have started talking about these things,
yeah,
and a lot of people
are becoming more aware.
Yes, are becoming more aware. But we'll still talk about it here.
Absolutely.
We have the AA, we have the AS, we have the SS. These are the 3 major types that people always talk about and know. Yeah. But we also have other ones. We have the SC, we have the AC, we have the CC as well.
Have you seen anybody like that before?
Of course.
Really?
AC as well. Oh, so we also have those ones. So as you know, genetics.
Okay, I like question.
Okay. So what do you call it? Genotype is just the genetic makeup of every individual. All right?
Yes, ma'am.
Just like I said earlier, that hemoglobin I talked about that is present,
yes, ma'am, the
parents pass one each to the offspring. So if you are an AS, yes, and you married an AA, you both pass 1 to that child.
Wow.
The husband might be passing A and the wife might be passing S, which brings us to AS. All right?
Yes, ma'am.
So the AA people are very proud.
They are very proud. I've seen them online.
They too the buga.
They are very proud.
So,
okay. Okay,
so
we have a question here from Sister Nkiru Kamaswe. She said, the AA positive or AA negative, which one is clean? Do you understand this?
No.
Do we have anything like AA negative and AA positive?
No. I think Sister Maxwell Nkiru, you're trying to mix the two up. AA is a genotype, and the positive or negative you mentioned there has to do with the blood group.
Absolutely.
So I think she's getting a little bit confused.
Maybe you can resend your question, what you meant to ask. If it's maybe AS and AA, we don't know. So we can understand better, okay? Thank you so much. Okay, so okay, like I was saying, at this point, looking at how destructive this can be, because we are talking about children being lost, and one of the most painful things that can happen to any parent is losing your children. And you know, this thing is something that you don't have, you cannot help it. Though we've heard that there are cure for it and all that, which I'm not very sure of, but I've heard that there are bone marrow transplant and all that, those kind of stuff. But at this point, what advice will you give as a medical personnel to people who are yet to know where they stand, and even those who know where they stand, to avoid possible mistake of, you know, getting married and having to bury their children, or, you know, being confused, because it's a state of confusion. Yeah.
I'll say no matter the level of love you think you have for a person, don't go into that.
Okay, now.
This is an advice. Don't get me wrong. You can still do what you want,
what
right?
you want, yes.
Yes, you can still do what you want. But I will advise, no matter the level of love you have for someone, don't go into it, because you're bound to regret it in the future. When you start having kids, I'm talking about, let's do it properly. Okay, the AA group of people, we just said earlier that they are safe. The hemoglobin for them is round in shape, okay, and that's perfectly fine. That's the normal shape of it. Then the AS part of the genotype, they are just carriers. They are also fine. There's absolutely nothing wrong with them. But the SS part, their hemoglobin is shaped like a sickle. That's why they call it sickle cell. You know, sickle, right? Like a half moon.
Wow.
You know, like a C.
Yeah.
Yes.
It's not totally
round at all. So that's what happens in. That's why they call it sickle cell. Okay. So if you have, if somebody is AS and you're getting married to someone who is also AS, that's where the problem lies. You have a very big tendency of getting AA as a first child, but what happens to the subsequent ones? Except you want, that is also not a guarantee, right?
Yeah.
Yes. Except you're ready to, like I said earlier, bear the burden, okay, of getting a sickle cell child. You know what it means. I don't think there is anyone listening to us who has not seen a sickle cell person before, or no one.
It's a big one.
Of course.
Yeah. It's a big
so because
one.
of that sickle shape, they tend to get lots of complications. While the blood is swimming through the veins, especially when it gets to tiny blood vessels, it gets stuck. You know, the round one just swims across, but the C shape, once it gets there, it gets stuck.
And then they
experience so much pain. Yes,
that's when they have crisis.
Yes. And then their hemoglobin gets destroyed faster.
That's why they are weak.
Yes. Because I mentioned earlier that this hemoglobin is the one that takes oxygen around the body. But once it gets destroyed very fast, that also means that they are short of breath, the organs of the body are not getting enough oxygen. So many things are going on with them, or it's going on with them. So you don't want to take that risk, looking at your child suffering every day just because you love someone that you're not able to. It's
very tough. It's very tough, guys.
You're not able to give up. You still want to be with this person despite everything. So you have to
be very
really
sure.
Think about it and be sure that you want to do this.
Wow.
Yes.
Guys, I hope you're learning something. You guys are not commenting. Drop your comment to encourage us. Share this broadcast because we are giving you quality information. You know, this is what people go to pay for, and we are giving it for you free of charge. So guys, you know, share this broadcast. Let's reach out to more people. So Staogi, I want to thank you so much because what you're doing right now, you never can tell who is listening and probably not aware of what we are talking about. But I want to ask also that we've seen cases of people, you know, having faith. Let me bring it up. You're not a pastor's wife. We've seen people having faith. I once saw somebody who testified that you know, she was married to AS, and then they have 3 children, and none was SS. And she's also AS. The husband is AS. And you know, testimonies like this can boost people's faith. And then they will just say, "Oh, it happened to this person, and I want to do this." I want to ask for those, you know, some people, no matter what you say, especially when they're in love, they know they hear. They will never hear. So in this case, let's not say we are talking to people who totally hear. In this case, are there solutions like, okay, it must be him, I must die for her, you know, those kind of stuff? At this point, is there any solution that even if they come together, is there any way it can be monitored or something, and then they can have, if it's 2 children or 3 children, depending on what they want?
Yes, they are.
Let's be on the positive side now.
Yes, they are. But I also have faith. And I know a lot of Christians out there have faith.
Yes, so.
But why leave everything to chance?
Okay.
Yes, that's the big question.
It's crucial.
Why leave the lady you talked about, yes, it's very possible. You can't be AS, married to an AS, and you have only AS kids. It's very possible.
I don't understand.
If you're AS, married to AS, you might have kids. You know, how this works is AS this side, AS this side. You give one, and he gives one for the child. He might give
S or something.
He might give A and you give S. The child is AS. He might give S and you give S. The child is a sickle cell. He might give A and you give A. The child is AA. You know? So that's the chance I'm talking about. So maybe hers was by chance good for her. But you that is listening to us, why take that chance? What chance do you know that you have? If you still want to take that chance, there is no problem. These days, there are some things that are being done. While the woman is still pregnant, a sample can be collected from her placenta. They call it chorionic villus sampling. They will just test it to see the genotype of the child you're carrying. Oh, it's possible to know the genotype of the baby in the womb? Yes. This is just recently discovered. Wow. If they discover is an AS, the child SS, the pregnancy will be discontinued. Good. Okay, the pregnancy will be terminated. I know, but we call it medical termination. That must be very painful. So I don't know how your faith and this one now will now work together. So it's still going to be a very painful ordeal for you because you're losing a child. That's tantamount to abortion. Yeah. So we also have the IVF. Okay. Yes, the IVF. Before the implantation, the child it will be tested to see the genotype of the child. And this one you're talking about nice for people that have money. Of course, you can't be talking about people that have money. You don't have money. Okay. Okay. So those are the things that you can do if you feel that you love. You are so much in love that you can. But we are not saying that this is right because looking at the way things can be, you never can tell how your life will be. So, and even back home, I don't think I don't know of any. Maybe there are, but I don't know of any hospital who does the pre-implantation. We call it pre-implantation genetic testing. Wow. Okay. I've not heard of any that can do it, and then So if you have money to fly yourself or your partner elsewhere, and you think that you are born together and must die together, why not? All right. So also I know that these guys are learning, and also we've had I've had a discussion with somebody who is from East Africa, and she said she has never heard anything about genotype and blood group, that it's not common in their area. Like they don't go for all those things, and they hardly see anybody with a SS. Yeah. I'm hearing this for the first
Oh,
time.
you also maybe you need to make a research because I was also very surprised. I thought what we got talking and all that, and the issue of SS came up and all that. I said no, it's not. They don't know about this in their place. So I was now wondering, is it that there are certain areas?
Maybe I don't know. I'm not aware, but maybe like let's just give an example with where we live now. You hardly see those things because once your favor that was born here, somewhere in her records you'll see it. It's already there. And if there is anything you should know about or you should be cautious about, you will be informed before you leave the hospital, so you don't even have anything.
Sorry, you continue. The kind of test they did on this my child, I was almost telling them to bring my baby for me. In the month, I wanted to discharge myself like I discharged myself during Michael. I discharged myself during Michael. I don't see doctor. They refused me. They said I must spend 3 days. They were cross-examining the child. So I totally agree with you, ma. Continue, ma.
So there is nothing for you to even say to favor. You are this. You need to be
all
careful.
The records are there.
Yeah, all the records are there. While the baby is being born.
Wow.
Okay. So maybe they started that way. I don't know if you're getting me. Maybe where she comes from, they are learned, or let me say they are exposed. Such things. I don't really know. I don't know. Really, I don't know why.
Okay. Or could it be that God planted some people to be AS in some areas? Because if Adam and Eve, no, because sometimes, sorry that I'm digressing, but sometimes these are the things that I see down personally. I'm someone who meditates a lot. And then when I'm looking at it scripturally, I'm like, why are these things in place? A little bit of digression anyway, in as much as you're teaching medically. I'm asking myself why. Because if we look at it, Adam and Eve, like, they taught us that these people are the ones who created, and there was nothing like that in the beginning. So how come we are getting to have these things?
See, the moment you begin to mix the scripture and science, you get the most confused.
Kibala, thank God that I asked this question.
Leave scripture as a scripture and leave science as a science. Yes. The moment I discovered that, while studying,
right?
While studying, like sometimes you get to sit and think about some things and going back to the scripture, they don't agree. So I advised myself to keep this is scripture and this is science. Just move the two as much as you can. Move with the two. That's it.
Oh my God. Okay, so we have a question. We have a question. Ma, the genotype. If you have AA, then in your blood group, you have positive or negative. Is it okay?
Yes. That's not even a case for discussion or an issue of discussion. It's okay. If you have AA as a genotype, you're fine. If you had blood group positive or negative of maybe O, A, B, A, you are perfectly fine. Your only concern should be, as a woman especially, women, as a woman, if you are negative, like rhesus negative, whether you are O, A, AB, anything, from your blood group now, I mean, if you're negative, that's when you begin to check yourself, be concerned about who you settle down with.
Wow.
If you are AA and you have a positive or negative, that's not an issue at all. It wouldn't affect your marriage, but it comes to play if you both want to have children.
So all of these things we'll be talking about boils down to when there is about to be a child.
Yes.
So people can actually marry. If you know you don't want to have children, you can settle down with anybody. But if you know you want to raise a family,
of course,
you have to be very, very careful.
Why not?
Wow.
You can settle with anyone you want. But once kids will be involved, then you have to think again.
Wow. Ha! Hey, so how do I know?
The bone marrow transplant you mentioned earlier, yes.
Yeah.
For people who are SS, yes, that's the only cure, bone marrow transplant. But then, as an adult, it's very difficult, except when it's a child involved. And even if it's a child involved, it's very difficult to get a relative who is
going to match
very closely matched, like genetically, to the patient.
It must be from a relative.
Of course. Wow. Who you share at least similar genetic makeup with. So before you get someone who matches very close to yours,
you have spent money.
Yeah. Because everyone will be tested now. And
that's why when you just mention that, you know, I know what that can be. It means this will come do.
And it's a very painful thing to do.
Oh my God.
It's a very painful thing to do.
Guys, please, let's just be careful. Let's be careful. This life, will just live this life once. So whatever decision you're making, just try as much as possible to make sure that you're making decision that is going to be favorable to both you and your children unborn. So that you don't start running to prayer houses when eventually you start having these things happening in your life. All right. So though I'm going to ask you another question from, you know, this angle, but I want to know, how do you deal with negligence from patients? Looking at the fact that, you know, we have so many people who are religious, which is an issue with medicine. We have people who believe that this is a pattern. We have people who believe they already even know more than the doctor. So some people, they believe in herbs, you know. So how do you deal with all of this, especially when it affects the patient to the extent that the person gets to lose their life? And you know that this thing is something that would have been, you know, that would have been prevented. In this kind of case, how do you deal with it as medical personnel? Because I sit down sometimes and I, you know, like the case where you brought up of somebody who probably the baby was breached and there was supposed to be CS. This is something that people even close their eyes to do these days. And then she gives you reasons why she shouldn't do that. And eventually she loses her life in the process of trying to push a child that is breached. In this kind of case, how is there any way that, you know, people can, I don't know, in my head right now, I think I'm asking a personal question. So
yes, I understand what you're trying to say, but like I said earlier, you can only advise people. You don't force your opinions down their throat. Yes. In the hospital setting, once you give an advice to a patient, this is what should be done, and they do not want to do it, they feel that there is another way they can do it better, you know. And if yourself as a medical person, maybe the doctor who is involved or the nurse or anything, is going to be implicated at the end of the day because of that person's refusal, the patient's refusal. Okay? Let's say, okay, like the cesarean section we talked about.
Yeah.
If she refuses to go in for that,
to sign for
she will simply be given a paper to sign. It will be documented. Because these same people can turn around tomorrow and come back and say, nobody told me about it, or I was even the one asking them to do it for me and they refused, you know. So that's where the documentation comes in. You just give them to say, okay, sit them down, explain again and again, this is the best thing for you. But you're also entitled to your own opinion. If you think you don't want to do this, that's also fine, but you have to sign. It will be clearly mentioned that you were advised, you were told about this, everything was done in order to convince you, and you didn't want it. So this person, I am taking full responsibility of whatever happens afterwards.
Wow.
Understand? So that's it.
So guys, I am going to advise personally, I thank God for the kind of pastor that we have, and so many pastors are actually involving, which is very good, because these days you see pastors who are also very much aware that medicine is not bad, which is God has given us doctors and nurses to take care of us. So it's not a bad thing that a doctor gives you an advice, or, you know, they do tests and they see things. I know it's good to rebuke things, I know it's good to stand by your faith, but let them do their own, right?
Yeah.
Let them do their own. Why you're having your faith, why not allow them treat you? We have had people that have had different kind of operations and they survived it, and some did not allow themselves to be operated on and they lost their lives. So why do you need to fight with them? In fact, what even took you to the hospital in the first place? If you knew that if you knew that whatever you're going for, you know it better, why did you go?
Yeah, that's
why
a
did
very
you go?
good question,
Why did you go? So if you know you're going, because it's like me going out to meet a doctor, it means I'm looking for a solution.
Of course. And then when the solution
when I get
is
there,
offered,
I'm now countering the solution. So why did you go? Just better stay in your house. So if you're going to the hospital, go with an open mind. Don't be too spiritual about it. Don't be too knowing. You cannot go and meet a doctor and you're teaching the doctor. You know, people know how to do these things.
Of course.
You're seeing a doctor with a licensed doctor.
You will even be telling them this medication, no, I think this will work better, you know. things like that. I think this will work better. I have a sister, my other sister, when she had it, she took this particular one, and she got well. Why are you now telling me to, take this one? Forgetting that you're a very different person from your sister.
My God.
We can't keep doing the same things
over and over again. And so many people have lost their lives in this process, and it's been tough. So guys, if you're listening, please, she just mentioned, okay, maybe we should just talk a little bit about this. Self-medication. This is what people do all the time. You see somebody having this, like I mentioned earlier, that I'm very used to myself. Now if I feel a little bit of headache, I just feel that my blood, my blood temperature is, and then I can just run to my box and say, I feel say my blood group is high. Then I just go and take one medicine, and I'm just, doing that. Sometimes people are always taking Panadol. Back home, Nigerians, I don't know about that, they're always taking Panadol. Anybody with headache, Panadol. So in this case, what advice will you give to people who are always doing self-medication all the time?
There is a limit to which your body can take. The problem with us is that we don't listen. And then we only go to the hospital when
it's crucial.
It's already critical. Like, at that point where you can't deal anymore. You see someone in January, you had body aches, you had this and that, you took Panadol. Everything went off. February, you have the same thing.
Ibuprofen.
Another one. March, continuous. That should tell you that something is wrong somewhere. At least get checked. Okay? Not just swallowing it. And this simple Panadol you're looking at. There's no medication that destroys the liver like this simple paracetamol. Yes. Paracetamol destroys the liver. So just imagine where you keep swallowing and swallowing. You don't even know what are you swallowing for exactly.
Sorry to cut you. And the ones they are taking back to Africa, it's not the medicine. Some of them are not even original medicine.
Of course, we know all these things.
So,
of course, they know. Whoever is taking it.
You knows. See, right? So people just consume this thing because most of them are not even from the real producers.
And then when we get young people, very young people who are suffering kidney failure, liver damage, we tend to like, what's happening? Our forefathers lived for, we start questioning that our forefathers used. Some of these things, some of these medications it's true that they are made from herbs and all that. There are some other chemical contents also. Swallowing them indiscriminately is not the best thing for you.
Wow.
At least get checked, so you know what is wrong with you and you know what you're treating.
Oh my God, I am so.
And another one is you using the medication that was prescribed for
from
you.
From the previous one.
No, for you. Maybe you had abdominal pain and then you went to the doctor. Good for you. And he gave you some medication. The moment I start feeling, I say, come, I have the medicine for you.
Wow.
It's okay. It's okay to do that, but not for you keep doing it again and again. Wow. If something is happening to you over and over again, that means there's something wrong somewhere. Go get checked.
My God. I'm so blown. Honestly, I'm so blown because these things that are happening, there are things that happen all the time, and yet we are not learning. I don't know, I'm coughing actually.
Sorry.
Thank you. And okay, I'm better now. And we are not learning, and it's really a problem. It's really a problem to see people go the way they are going, and we really want this to stop. So for me, there is something that always comes to my mind. Excuse me. We must do this program. Yeah. There's something that always comes to my mind. There's no fun. Oh no. All right, I'm good. There's something that always comes to my mind. You see somebody who is very strong. I want to just know this for myself. I don't know, maybe some other people. Somebody you've treated, because I've had a case like this with a doctor friend. This man was already recovering. You've treated him. He's been there in the hospital, he's becoming more than a patient. Let me put it like that, because this person has been on admission for more than 3 months or something like that. And then why you're even telling them, oh, I want to go for your Thanksgiving and all that, because they are recovering so fast. And then you just wake up one day, maybe you're not even on shift, and then they say this person has passed away. I've seen a doctor friend who cried for somebody, and at that point I was confused myself, because I usually I think that you guys are just used to these things.
No.
So how do you, because for me in my brain I'm like, so how do you deal with these things as a medical personnel? You just see people you're already falling in love with. They are more like family members now, because every day they call you, nurse, you don't come, nurse, you're back, and then tomorrow while you're thinking, oh, they will soon be discharged, and then they just pass on. How do you deal with all of this? And you're still normal amongst us.
Yeah, it's not very easy like people always think. Yes. I don't think I've seen anybody who beat their chest and say, is it not just that? Let them die, you know. They're still a part of us, a part of the doctor, a part of the nurse, that still feels what you feel.
Oh my God.
But sometimes they might not show it in front of the relative, the patient relative, you know, or something.
Professionally.
Yes, professionally. But they cry behind closed doors.
Oh my God.
Yes. I've lost some patients, and I was not able to eat because I lost them. Just like you say, when you start creating that friendship and family, I still have some numbers for my patients on my phone, and we do chat till this day. So I've lost some people that I'll just, let me use the word, man up in front of them.
You woman up.
Woman up.
You woman up.
I woman up. I like pretend like
Child.
Oh, it's very sad, but I go behind and I cry. So it's not as if they don't feel it.
It's so easy for you guys.
No, it's not easy at all for anybody. It's human beings we're talking about.
Exactly.
Even though you don't know the person, not to talk of someone you've created a rapport, a bond.
You've been
with,
treating and all that.
So it's not really easy for them as people think. They do cry. Doctors cry, nurses cry. When they go inside, they cry, they clean their eyes, and they come out again. Hi, you know. So.
Wow. So guys, you just said, this is one question I've been wanting to ask. Like, you know, you see all these things happening, and the doctor will just cover the person and be like, he's gone. And then you see the family shouting, say, then he'll just tap you like this, and then he's gone. I'm like, how do these guys do this thing? And
They also cry. They also cry. But you know, once something like that keeps happening, when you get used to it, it will seem, even though you get pain, it will seem as though you don't feel anything at all. Because it has happened over and over again. It now become like
a normal thing.
Yes, normal thing.
Wow. So guys, you see that the doctors and the nurses are just like you. The only difference is that, you know, this is what they do professionally. Just like you are a lawyer, you go to defend your client. So when they treat you also, it's,
even though you know the
you
client is at fault.
You know the client is at fault. You still defend them.
Stand and defend them.
You know, so this is how the doctors, and they are all built up in this way. They've been trained, so they act professionally around. That doesn't mean that they don't feel what you feel. All right. So I believe we should show more love to the nurses and doctors, because when you go online sometimes you see how they are bashed, especially our nurses in Africa. Though I've had my share of, you know, their character and all that, and I'm happy that you're a registered nurse and you're here. Before we call it a wrap, we're going to have another section some other time. Can you just please help us defend these nurses and doctors? Because if you ask me personally to write a story on doctors and nurses, I'll probably give a very bad story. Because let me give this. When I was having my son, I registered in a general hospital. I didn't want to use a general hospital, but my mom is someone who believes in teaching hospitals and general hospitals, because she believes that that's where you have professionals.
Yes.
So any case, you don't have to be running or they are referring you, because they are supposed to be all complete there. And I took it upon myself to obey my mother. I went and I registered in a government hospital. Time to give birth, I was in the labor room. I will not see doctor. The nurses are gisting, and I'm shouting my life out. And then somebody will just come and be like, madam, you never still born. No empathy. And I'm like, yeah, you know, that was my first baby. I was almost passing out. My husband is not, nobody is even there with me. Just, And then when you're praying, they say, madam, don't pray. Save your breath for the pushing. You know, at that point, you start looking at these people like, are you really human? You know, if not that, you know, I'm not a violent person, with those kind of statements, some people can even fight the nurse at that point, because it's more like, this is my life on the line. At least, why I'm saying this now, because I had another baby, and the treatment was different. In a foreign land, I had nurses who were massaging my waist. In fact, I almost didn't know I was in labor till I almost gave birth. And the treatment was different. I had 2 doctors to me, like 4 nurses. These our nurses back home, they will not even answer you. You call them, they say, madam, just they do one small. Madam, don't worry, we know, it's still far. Then the way you shout it determine how far it is. Sometimes when they check, they say, madam, it's just 4 cm, you just they start. You know, those kind of treatments. And you start wondering, madam,
and
no
humans.
So at this point, people have generalized that doctors, let me know, most of the time they don't really talk about doctors, but nurses, they just believe that nurses are wicked. You know? Please, can you help us?
Yes. In every profession, you still get some people who act out of line or out of place, right? Yes. I agree that some people are like that. Just like you mentioned here, when you had your baby girl, you said you had 4 nurses, 2 doctors, you know. Back home, I think personally, I think what brings about all those attitude from them sometimes is the workload.
The stress is too much.
Workload is one of it, from my experience personally.
So it's a
I'm
government.
not speaking for for myself. Yeah. So especially
and it could be true because government hospitals are crowded. Yeah.
So as a nurse working in that facility, the ratio of a patient to nurse, maybe a nurse will have like 5 patients or 7 patients, you know, that you're taking care of alone. Everything about them is on you. And then in this other side, you have a patient with 4 nurses. You know, the frustration, it's not supposed to be so. I'm not trying to make an excuse.
I know what you're saying. Though I actually had my baby here also in a government hospital. That's
what I'm saying. That's the difference here. You can see that here you have only you with 4 nurses and 2 doctors.
And 2 doctors, a senior doctor and a junior doctor.
There will be maybe a junior doctor, and then 1 nurse, you're sharing her or him with 6 other patients. My God. Maybe by the time you're screaming nurse, she's with the other one, and by the time the other one is screaming, she's also here. That's one thing. That's one of it. Secondly, I think the attitude also
of the individual.
Yes, the individual. I will not generalize it because I've met nurses who have gone out of their way to see that patient. Right. So right. I think
these ones here, they were going out of their way. Absolutely not back home.
Even back home, I've seen nurses back home who have gone out of their way to help patients as though they are related. You understand? Yeah. So I still believe that the attitude of the individual is still a contributing factor.
Anyways, for those of you that have had issues with doctors and nurses, this is my honorable sister saying that sometimes it could just be the workload, and I totally agree with that, because I remember those days when I have to go for my antenatal. I go as early as 5 a.m. or 6 a.m. and yet my number will still be like 30 something, and then you see everywhere crowded, so it's a lot of work for them.
And you know what, sometimes, sorry to go to sometimes these nurses, we already know they are overloaded or over-laboring themselves. The attitude of the relative or the patient themselves tend to also get to them and trigger them. This person is trying to fix it all, take care of everyone, and then you're bringing up an attitude. I'm not trying to make an excuse.
This is your opinion anyway.
My opinion. Yeah. Sometimes I'll use myself as a case study. I'm trying to do everything possible to see, and someone somewhere is like, what is this, bringing out attitudes like, okay, I've just been wasting my time all along. Yeah. No appreciation.
No appreciation.
Like, just a simple well done to someone can, make them very happy, and then no appreciation. I don't mean money. I just mean well done. Yeah. Like doing a very good job. True. Speak kindly to them, at least. True. Even if you don't say well done, be kind. Speak to them in a way that they don't feel threatened, they don't feel like you're harassing them and all that.
Wow.
So,
and these are things that we don't really talk about when it comes. I think all these sections are sections that, you know, maybe some other time we can just put them together, because I think we're always defending the patient. Most times the nurses don't have a voice, because it's more like everybody is bashing them. Oh, this nurse, you know, you see what the example I gave to you, but does it mean that they left me to die? No, they later came through for me because they delivered the baby for me. But the first experience is what I'm holding on to now. But at the end of the day, I didn't deliver the baby on my own. So there are nurses and doctors that I think also we need to appreciate them more, in as much as we know that our government has already failed in that aspect, which is another topic on its own. But at the end of the day, nurses and doctors should be appreciated. They are doing a lot. And I think for me, I think God has blessed them with us. God has blessed us with them, rather. God has blessed us with them, and we should appreciate them. So please, while we conclude all of this, Sister Oge, any advice generally in conclusion, you know, for people who are yet to know their genotype, people who are yet to, you know their resource factors, people who are yet to, you know, they are just hoping on God for everything. Do you have an advice for them?
Yes, I have an advice, especially for the young women out there.
This thing is mainly for women.
Yes. Men are also, like the negative and positive incompatibility we talked about. The men, there are men who are negative, but they are very few.
Wow.
The women are more. You understand? So if you are a young lady out there listening to us, go get checked. I will say this clearly. Most of you who are listening to me know me.
Yeah.
I'll say it clearly, mind the type of life you live. I'm
Say
saying it again.
I don't want to quote again. Say
The type of life you live.
Wow.
Just like we were saying earlier, maybe I am a young lady. I am resource negative. And I have a boyfriend, of course. Everybody has a boyfriend in Dubai. And he's positive. I don't know. I don't care. He also doesn't care. I get pregnant for my very good boyfriend. And along the line, the pregnancy was discontinued, intentional or unintentional. What we spoke about earlier, the antibody, of course, is going to play.
If the person legally marries tomorrow.
Of course.
Are you serious?
Once you didn't take the medication, the injection after the abortion, it comes to play. It's not only for married people, excuse me. It's for everybody.
Wait. I know you are supposed to give an advice like a final. Are you saying that if, because you brought in the boyfriend and the girlfriend thing, let's say the person got pregnant and the baby was not had, but the baby was removed, not even born?
Of course.
And it has registered that a baby was there.
I mentioned earlier that when there is a miscarriage, an abortion, delivery, that is the only time, or even a trauma that causes initiate the placenta and the baby, you know, that mix of blood would be there. So once it happens, it has happened.
Wow.
And the funniest thing is, once these antibodies are formed, they are formed forever.
Really?
Yes. They are formed forever. I'm not trying to say tomorrow when they get married, they cannot have, no. But the thing is, there's going to be a lot of running around. Because the babies, the subsequent babies that are coming in, especially if they are positive, okay, whatever we spoke about earlier, I don't want to go back again, whatever we spoke about earlier will be there. Sometimes when these babies are born, especially in very severe cases, there has to be what we call an exchange transfusion. This is removing the blood from the baby, the blood which the baby has, because the mother's antibody is already acting on the baby by breaking down the red blood cell, the hemoglobin of the baby, breaking it down. The baby is anemic, the baby is jaundiced, jaundice. The baby is already, because...
Is it part of it that causes that?
No, it is not the only, this is not the only cause of jaundice.
Oh, okay.
It's part of it. I'm talking about the complications of
okay.
So the baby is already jaundiced, so they will be like phototherapy, the one normally put the baby in. and then exchange transfusion in severe cases. They'll just remove the baby's blood and put in.
And most babies don't remain normal. I know somebody whose child was done that. Baby wasn't.
Something
Baby
else.
shaking.
Even this jaundice is just when the hemoglobins are broken, the end product. Do you know if they travel to the brain, it causes damage to the brain?
That the baby is shaking. They say the baby had jaundice. Yeah.
It causes brain damage.
Oh my God.
That bilirubin, the broken down part of that hemoglobin is called bilirubin. That bilirubin circulating in the body is simply what makes the baby yellow. Like you say, the baby has jaundice.
Yellow eyes.
So once these hemoglobins are broken, then bilirubin is released into the bloodstream and it travels to the brain. There will be a brain damage.
Please, I beg.
So know how you live your life.
My God.
Know who you're dating. Be prepared. Go to the hospital and get checked. It's not something that doesn't have a solution. Go to the hospital and check, especially before pregnancy or at the earlier stage of pregnancy. So you could be followed up. If they discover that, okay, these antibodies are already built. That is if I'm talking about rhesus negative mothers. If these antibodies are already built, then close monitoring and all those things, frequent visits will be arranged where you can be properly taken care of.
Okay. Wow. So before we close, this thing just came to my mind. You know, you mentioned earlier that a baby can be tested and all that. Is it possible for babies to be tested at early age to know? Is there a time frame to check? Because so many people might be having babies now. They don't even know if the baby is AS or if they are AS. You know, those kind of stuff. Is there any certain age that you can check for a baby's genotype?
No.
Or is it from birth?
Once a baby is born, if you go to your records, I'm telling you this now, go to Favor's records that was given to you from the hospital, you see it there.
Really?
Yes.
Nah, what the person no. Oh my God.
Yeah, it's just back home that, you know, some of these things are not even properly taken care of. Give birth to your child and carry your baby go house. Here they do everything.
So it's possible at any. I used to think that there is a certain age you get to then.
No.
So guys, it's something you can even do anytime.
Of course.
Wow.
That's why if the baby is delivered, they will check. And if really this baby is positive, you'll be given that injection, the Rogam, within 72 hours of delivery. I'm talking about the blood group. Yeah, even back home. Yes.
Okay.
But the injection is very expensive.
Yes. I don't want this discussion to finish. You know, I told you guys from the beginning that anything that has to do with health, because so many of us, our negligence is 100% or even 1000%. With anything that has to do with our health, we don't prioritize it. We don't want to spend money on our health. We don't want to believe the doctors. And yet, people are dying on a daily basis from things that could have been prevented. And I'm sure that you guys have learned so much from all that we have said. She just told you, as a young lady, be careful. Even as a young man, this also enlightens the men in such a way that they can open their eyes. Now, for those that are not married, you're learning for the woman, right?
Yes.
To be able to put them in check also, because they might not know. So you know, at that point, you make it obvious and, you know, draw the awareness so that even if you need to take her to the doctor, then you do that and you guys get
Or at
checked.
least when she gets to the doctor and they say this is the issue, you already know.
Have an idea.
Yes, of what they are talking about.
Wow. I hope you guys have been blessed. Personally, I have. And I want to thank you so much for coming through. It's been such a great honor to have you, ma. It's been such a great honor. I've learned so much, and we are trusting God that you're going to give us this opportunity again to have you here.
Thank you for having me. I feel honored to be here as well.
Oh my God. Thank you so much, ma. Okay, guys, so thank you so much for all your support. Thank you for all that you're doing for PC Studios. We love you guys so much. Continue to share our videos, continue to like, and continue to subscribe. God bless every one of you. Thank you.